Dad. I'm still working, but I'm turning 65. Do I need to enroll in Medicare?
Now, I gotta say, you are a very, very young looking at age 65. But in all honesty, the answer is it depends. And it depends on the type of insurance that you're currently on. So let's talk about three common scenarios that I see all the time. Let's say you're reaching age 65 and you're working and you're receiving your health insurance via the Affordable Care Act, via the healthcare exchange. In this case, you would enroll in Part A if you're eligible for premium-free Part A. Right? And in order to qualify for premium-free Part A, again, you need to have worked and paid into the system for long enough, either through payroll tax or self-employment tax. You, your spouse, your ex-spouse, deceased spouse in certain situations, with certain parameters. Then you're eligible for premium-free Part A. So you would enroll in that. Done. Fine. You would also enroll in Part B. Now, yes, there's a premium for Part B. There is. But what happens is, one of the main reasons you would enroll in Part B is because a lot of folks are on the exchange and are eligible for a subsidy. So it makes that health insurance less expensive. Well, if you're eligible for premium free Part A, then the government, the feds are going to say, you know what, we're not giving you that subsidy anymore once you turn 65, because the exchange marketplace was not designed to provide insurance for people once they reach age 65. It just wasn't. The idea was to move you over to Medicare. So when you reach age 65, you're going to have to start paying the full price of that healthcare plan. And those exchange plans are very expensive, and it's very likely that those costs for that exchange plan, subsidy free, is going to be a lot more expensive than Medicare Part B. So you want to go ahead and enroll in Medicare Part A and Medicare Part B, and then you got to decide whether you're going to go with a Medigap plan and a Part D prescription drug plan, or you're going to go with Medicare Advantage. But in this situation, you're turning 65, you're on the healthcare exchange, in the marketplace. You need to enroll in Part A. You have to enroll in Medicare. You need to enroll in Medicare. Now, this second situation, you're reaching age 65 and you're working for an employer and you're getting your insurance through that employer's health insurance plan. But it's a small employer. And the definition for Medicare purposes of a small employer is an employer that has less than 20 employees. Now, in this case, again, you're going to enroll in Part A because Part A is free. Let's say you're eligible for premium free Part A. You're going to enroll in Part A because that may give you some additional coverage in case you're hospitalized. But you're also going to enroll in Part B as well. Now, why? Well, because if you have this small employer plan, Medicare will be the primary payer, and your plan, if you choose to keep it, will be the secondary payer. Now, if you don't, that's how those two plans coordinate when it's a small employer plan. Now, if you don't enroll in Medicare at age 65 when you're eligible, well, then you don't have that primary payer anymore. And your secondary payer, which is your small plan, your small employer plan, is only going to pay after Medicare pays. And if you don't have Medicare, Medicare doesn't pay. So your secondary plan is not going to pay. So you're exposed to all of that cost. Very important. Very important. Once you're reaching age 65, call your benefits person through HR. Call your healthcare plan and learn how they coordinate with Medicare. Second scenario, you're reaching age 65. You have a health insurance plan you have coverage through your employer, but it's a small employer with less than 20 employees. In this case, Medicare is primary. Your healthcare plan, your medical plan is secondary. Still, you need to enroll in Medicare in this situation. Now, number three, last situation. Similar to number two, you're reaching age 65 and you're working for an employer and you're getting your health insurance via that employer, but you work for a large company. And by large, we mean has employees of 20 or more. This is a large employer. Now, this is different. The situation is kind of reversed. So you're going to still likely enroll in Part A because it's premium free. Why would you not? Why would you not enroll in Part A? You'll get some additional coverage, again, in case you're hospitalized. In terms of Part B now is going, or Medicare is going to be your secondary payer. Your large employer coverage is going to be your primary. So your primary is going to pay first, and then secondarily, your Medicare, your Part B plan is going to pay. Now you can decide in this situation, does it make sense to enroll in Part B? I'm paying the premium, but I got this great coverage. You can delay, you cannot. In this situation, if it's creditable coverage, meaning your health insurance plan is better or the same or better coverage than Medicare, and you have this large employer coverage, you don't have to enroll in Part B. This is the situation where you can delay enrolling in Part B. And then once you retire, then officially retire and stop working and don't have that health insurance anymore, then you can enroll in Part B, and that kind of starts your clock in terms of enrolling in purchasing a Medigap plan or a prescription drug plan or a Medicare Advantage plan. So in this situation, you're reaching age 65. You have insurance coverage from a large employer, 20 employees or more. Enroll in Part A. If you want to enroll in Part B, you can or can't. You have to make that determination based on your existing plan and the benefits. Again, you should call your HR benefit provider and ask how it coordinates with Medicare. In this situation, you can hold off on enrolling in Part B. Hold off on paying that premium because you already have you already have hopefully good coverage. And then down the line, when you retire or thinking about retiring, when you get to that planning stage, you can think about like enrolling in Part B. So those are your three situations. If you fall into those buckets, think about it long and hard. Do your research because you only have one chance at a successful retirement.
I got it. That makes sense, Dad.